now, let's welcome Dr. Kyle McCool from NHRMC Radiation Oncology here in Supply. Welcome, Dr. McCool.
Thank you for having me. It's my pleasure to be here.
It's great to have you. I'm excited to hear all about your practice here local. So let's start the way I usually start all my interviews. I like to know where you went to school, where you came from, where you grew up.
Sure. I'm a native of Mississippi.
Really?
I grew up there and went to the University of Mississippi for my undergraduate degree in biochemistry. From there, I went to Georgetown University School of Medicine, spent 4 years there for medical school, and that's sort of where I discovered where I wanted to go with my medical career, and then went on to do my radiation oncology training between Boston Medical Center and New York Presbyterian Brooklyn Methodist Hospital in New York.
Wow. You've been around.
Yeah, I've been up and down the East Coast, and most of my training was in the Northeast. But as I said, I grew up in the South, and my goal overall was to try to move back further south, and that's part of why I ended up here in North Carolina.
Oh, it's a great place to live. The weather's good.
Absolutely. And you know, after your residency training, you're trying to find the right job with the right practice, and
that's the hardest part, I think.
It really is, because you have a number of different options. You can literally go anywhere. Part of the reason I ended up coming here was when I interviewed with the practice I'm with now in Wilmington. I got to meet, you know, some of the members of my practice, some of the other radiation oncologists, and I knew that by coming here I'd be working with passionate, intelligent physicians that would strive to stay at the front edge of cancer care. And you're right, this is a very beautiful area. There's a number of things I like to do, including boating and fishing, and so
you're in the right spot.
This is the perfect area for that. And an added bonus is my wife is from this area. She grew up in Wilmington.
Really?
And yes,
that's nice.
She grew up here, and she is also back here now as a physician in the community, as an orthopedic surgeon.
Oh wow, that's great. Well, how in the world did you decide on radiation oncology? What drew you to that?
Yeah, so when I was in medical school, you know, there's the academic part of it where you're studying, but you also have clinical exposure. One of my mentors was a neurosurgeon at Georgetown, and I was doing research with him on a particular type of spinal tumor, and he would perform the surgery to remove the tumor, and then patients, part of the study was the patients would go get radiation to see if there was added benefit for reducing the risk of that tumor coming back after it had been surgically removed. And it was that point that I got exposure to the whole field of radiation oncology. I got to interact with the doctors at Georgetown, and I was just blown away about this sort of non-invasive approach to treating cancer. It's not surgical, but we used high-energy X-rays and electrons, these different forms of radiation to be able to go deep within the body to treat tumors, and thereby give them a lower risk of their cancer progressing and hopefully extend their life. And so it was sort of that combination of cancer care for patients. It also appealed to my interest in physics and technology. It's one of the most technologically advanced fields in medicine, and it's constantly changing. It's a big area where research plays an integral role for advancing cancer care.
That's awesome. That's a great story, and I can see why you were drawn to that. So tell me a little bit about your practice. Now I know it's called NHRMC Radiation Oncology because you provide cancer treatment services to New Hanover, but you also have another name, right?
That's right. So I'm a radiation oncologist. I'm one of 7 radiation oncologists that provide services in New Hanover County and Brunswick County. Our practice is called Coastal Carolina Radiation Oncology. It's a physician-owned private practice, but we provide exclusive services for New Hanover Regional Medical Center, which is now part of Novant Health. So yeah, we're pleased to be able to provide radiation therapy services, not just Wilmington and Supply, but New Hanover County, Brunswick County, as well as the other surrounding counties, including Columbus and Pender County.
And, yeah.
Yeah, so you know, we can see patients from all over the place. You know, this is a very diverse community.
It is a very diverse.
There's also a number of university hospitals within North Carolina, including UNC. Wake Forest, Duke. So a lot of patients will go there for their initial workup or treatment recommendations, but they're able to come back here for their radiation therapy or other oncology services.
Right. And you practice here in Supply, which is right down the street from us, as well as in Wilmington. So that's great for our population around here.
That's right. We're just down the road.
So talk to me a little bit about when you see a new patient. What are the first steps getting them to their radiation oncology treatment?
So their first encounter with a radiation oncologist is the consult. That's where they come to the clinic, we introduce ourselves, and we go through pretty much everything they've been through, starting with the initial biopsy or discovery that they have cancer, all of their workup, which often includes imaging, and we'll go over their diagnosis, their stage, and then we'll talk about what the best approach would be for their treatment. Oftentimes, they've already seen their family doctor, other oncologists, including surgical oncologists and medical oncologists.
Right.
So we'll kind of use all that information to come up with the best approach to whether or not they need radiation therapy, and if it indeed would provide a benefit, then we'll kind of decide their treatment course at that point. The next visit, we'll invite them back. They'll come for radiation treatment planning. That's usually an hour-long visit where we'll map out the area that needs to be treated. So if it's a skin cancer, the setup is more straightforward. We can see the skin cancer. We'll map that area out, and that'll kind of give us an idea how to develop their radiation plan for that site. Most cancers, though, are beneath the skin or somewhere else in the body. And so we'll do some other imaging techniques, including CAT scans or even MRIs or PET CTs to be able to really know where we need to focus the radiation. We'll then develop their plan over the course of 1 to 2 weeks once we have all that data. And then the next visit for them will be to come back, we'll verify their setup and treatment positioning, make sure they're comfortable, and then treatment begins. And then people that go through radiation therapy can go from anywhere from one treatment, that may be all it takes, to a number of treatments. If it's a more protracted treatment course, patients will come once a day, 5 days a week for a number of weeks. And so during the week, they're surrounded by not only their physician, but a number of nurses and radiation therapists that can help guide them through their treatment. One of the things that appealed to me about radiation oncology is its multidisciplinary aspect.
Right, that's true.
And we're able to talk to experts in other areas of medicine to you know, usually once, at least once a day or several times a week, we'll have something called a multidisciplinary
like a committee meeting?
Yeah, a committee meeting or a tumor board, as sometimes called.
I love tumor boards. So much great information comes out of that.
Yeah, so we're all able to sit down and focus on one patient at a time and come up with the best course of care for that person.
Yeah. Well, before we run out of time, I want to remind everyone that November is Lung Cancer Awareness, and remind those that are at high risk to get screenings. How important is that?
Oh, it's tremendous. So, you know, we talk about screening. One of the underlying principles of screening is people have better outcomes if you can catch the cancer early. And so a lot of folks know about breast cancer screening, prostate cancer screening, you know, the dreaded colonoscopy for colorectal cancer screening. And that's been around for a while. Newer to the scene is this idea of lung cancer screening. In fact, the United States Preventive Task Force within the last 10 years released its recommendations about who should be screened for lung cancer. And again, the idea is that, you know, if we can catch these cancers early, the treatment's often more straightforward. We have a higher likelihood of cure with fewer side effects. So the recommendation for lung cancer screening, if you're age 50 to 80 and you have a smoking history of at least least 20 pack years. That means you've smoked a pack of cigarettes a day for 20 years, or if you've smoked 2 packs of cigarettes a day for 10 years, that comes out to 20 pack years.
Yeah.
And you're a current smoker or you've quit smoking within the last 15 years, you would qualify for lung cancer. Yeah, for lung cancer screening. The best person to ask would probably be your family physician.
Family physician, that's always the most important step.
It is. They can give you a lot of great information about whether or not you qualify for lung screening. And what it basically entails is a once-a-year low-dose CAT scan or CT scan. And that's going to basically, it's a form of X-ray imaging, but it shows us a clear picture of the lungs to help us see if there are any signs of early stage cancer that we need to then further work up. If you have a positive result, that may lead to more scans, a dedicated diagnostic CT scan or PET CT, or potentially a biopsy.
Well, I have tons more questions. Will you come back?
I would love to come back. Yes, I think we have a lot more to talk about.
We make it very easy for you. So there's so much to talk about, and I want to remind everyone that your practice is right down the street.
That's right.
On 17, and please do come back. So thank you very much for being here today.
Again, thank you for having me. I would love to come back anytime.
Great.